Section 43 of Gray's Anatomy, Part 5. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by Jeannie Whitfield. Anatomy of the Human Body, Part 5 by Henry Gray, Section 43, the Thymus. 4C. The Thymus. The thymus is a temporary organ attaining its largest size at the time of puberty. Hamar. When it ceases to grow, gradually dwindles and almost disappears. If examined when its growth is most active, it will be found to consist of two lateral lobes placed in close contact along the middle line, situated partly in the thorax, partly in the neck, and extending from the fourth costal cartilage upward, as high as the lower border of the thyroid gland. It is covered by the sternum, and by the origins of the sternohyoidea and the sternothyroidea. Below it rests upon the pericardium, being separated from the aortic arch and great vessels by a layer of fascia. In the neck it lies on the front and sides of the trachea, being the sternohyoidea and sternothyroidea. The two lobes generally differ in size. They are occasionally united, so as to form a single mass, and sometimes separated by an intermediate lobe. The thymus is of a pinkish-gray color, soft and lobulated on its surfaces. It is about 5 centimeters in length, 4 centimeters in breadth below, and about 6 millimeters in thickness. At birth it weighs about 15 grams. At puberty its weight is about 35 grams. After this it gradually decreases to 25 grams at 25 years, and less than 15 grams at 60, and about 6 grams at 70 years. Development. The thymus appears in the form of two flask-shaped entodermal diverticula, which arise, one on either side, from the third brachial pouch, and extend lateralward and backward into the surrounding mesoderm in front of the ventral aorta. Here they meet and become joined to one another by connective tissue. But there is never any fusion of the thymus tissue proper. The pharyngeal opening of each diverticulum is soon obliterated, but the neck of the flask persists for some time as a cellular cord. By further proliferation of the cells lining the flask, buds of cells are formed, which become surrounded and isolated by invading mesoderm. In the latter, numerous lymphoid cells make their appearance, and are aggregated to form lymphoid follicles. These lymphoid cells are probably derivatives of the entodermal cells, which line the original diverticula and their subdivisions. Additional portions of thymus tissues are sometimes developed from the fourth branchial pouches. Thymus continues to grow until the time of puberty and then begins to atrophy. Structure. Each lateral lobe is composed of numerous lobules, held together by delicate areolar tissue, the entire gland being enclosed in an investing capsule of similar but denser structure. The primary lobules vary in size from that of a pin's head to that of a small pea, and are made up of a number of small nodules or follicles, which are irregular in shape and are more or less fused together, especially toward the interior of the gland. Each follicle is from 1 to 2 millimeters in diameter, and consists of a medullary and a cortical portion. These differ in many essential particulars from each other. The cortical portion is mainly composed of lymphoid cells, supported by a network of finely branched cells, which is continuous with a similar network in the medullary portion. The network forms an adventitia to the blood vessels. In the medullary portion, the reticulum is coarser than the cortex. The lymphoid cells are relatively fewer in number, and there are found peculiar nest-like bodies, the concentric corpuscles of Hassel. These concentric corpuscles are composed of a central mass consisting of one or more granular cells and of a capsule which is formed of epithelioid cells. They are the remains of the epithelial tubes which grow out from the third branchial pouches of the embryo to form the thymus. Each follicle is surrounded by a vascular plexus, from which vessels pass into the interior and radiate from the periphery toward the center, forming a second zone just within the margin of the medullary portion. In the center of the medullary portion there are very few vessels, and they are of minute size. Watney has made the important observation that hemoglobin is found in the thymus, either in cysts or in cells situated near to or forming part of the concentric corpuscles. This hemoglobin occurs as granules or as circular masses exactly resembling colored blood corpuscles. He has also discovered in the lymph issuing from the thymus similar cells to those found in the gland, and like them containing hemoglobin in the form of either granules or masses. From these facts he arrives at the conclusion that the gland is one source of the colored blood corpuscles. More recently, Schaefer has observed actual nucleated red blood corpuscles in the thymus. The function of the thymus is obscure. It seems to furnish during the period of growth an internal secretion concerned with some phases of body metabolism, especially that of the sexual glands. Vessels and nerves. The arteries supplying the thymus are derived from the internal mammary and from the superior inferior thyroids. The veins end in the left innominate vein and in the thyroid veins. The lymphatics are described on page 698. The nerves are exceedingly minute. They are derived from the vagi and sympathetic. Branches of the descendens hypoglossy and phrenic reach the investing capsule, but do not penetrate into the substance of the gland. End of section 43. Recording by Jeannie Whitfield.
Of Gray's Anatomy Part 5. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recorded by Laurie Anne Walden. Anatomy of the Human Body, Part 5, by Henry Gray. The Hypophysis cerebri. The hypophysis, pituitary body, is a small reddish-gray body, about 1 cm in diameter, attached to the end of the infundibulum of the brain and resting in the hypophyseal fossa. The hypophysis consists of an anterior and a posterior lobe, which differ from one another in their mode of development and in their structure. The anterior lobe is the larger, and is somewhat kidney-shaped, the concavity being directed backward and embracing the posterior lobe. It consists of a pars anterior and a pars intermedia, separated from each other by a narrow cleft, the remnant of the pouch or diverticulum. The pars anterior is extremely vascular, and consists of epithelial cells of varying size and shape, arranged in cord-like trabeculae or alveoli, and separated by large, thin-walled blood vessels. The pars intermedia is a thin lamina closely applied to the body and neck of the posterior lobe, and extending onto the neighboring parts of the brain. It contains few blood vessels, and consists of finely granular cells, between which are small masses of colloid material. The pars intermedia, in spite of the fact that it arises in common with the pars anterior from the ectoderm of the primitive buccal cavity, is often considered as a part of the posterior lobe which arises from the floor of the third ventricle of the brain. Although of nervous origin, the posterior lobe contains no nerve cells or fibers. It consists of neuroglia cells and fibers, and is invaded by columns which grow into it from the pars intermedia. Embedded in it are large quantities of a colloid substance histologically similar to that found in the thyroid gland. In certain of the lower vertebrates, for example fishes, nervous structures are present, and the lobe is of large size. From the pars intermedia a substance, no doubt an internal secretion, causes constriction of the blood vessels with rise of arterial blood pressure. This substance seems to have a stimulating effect on most of the smooth muscles, acting directly upon the muscle causing contraction. It also increases the secretion of the urine, of the mammary glands when in functional activity, and of the cerebrospinal fluid. Extracts of this lobe also influence the general metabolism of the carbohydrates by accelerating the process of glycogenolysis in the liver. The pars anterior exercises a stimulating effect on the growth of the skeleton and probably on connective tissues in general. Enlargement of the hypophysis and of the cavity of the sella turcica are found in the rare disease acromegaly, which is characterized by a gradual enlargement of the face, hands, and feet, with headache and often a peculiar type of blindness. This blindness is due to the pressure of the enlarging hypophysis on the optic chiasma. Development of the hypophysis cerebri. This in the adult consists of a large anterior, consisting of the pars anterior and the pars intermedia, and a small posterior lobe. The former is derived from the ectoderm of the stomadeum, the latter from the floor of the forebrain. About the 4th week there appears a pouch-like diverticulum of the ectodermal lining of the roof of the stomadeum. This diverticulum, pouch of Rathke, is the rudiment of the anterior lobe of the hypophysis. It extends upward in front of the cephalic end of the notochord and the remnant of the buccopharyngeal membrane, and comes into contact with the under surface of the forebrain. It is then constricted off to form a closed vesicle, but remains for a time connected to the ectoderm of the stomadeum by a solid cord of cells. Masses of epithelial cells form on either side and in the front wall of the vesicle, and by the growth between these of a stroma from the mesoderm the development of the anterior lobe is completed. The upwardly directed hypophyseal involution becomes applied to the anterolateral aspect of a downwardly directed diverticulum from the base of the forebrain. This diverticulum constitutes the future infundibulum in the floor of the third ventricle, while its inferior extremity becomes modified to form the posterior lobe of the hypophysis. In some of the lower animals the posterior lobe contains nerve cells and nerve fibers, but in man and the higher vertebrates these are replaced by connective tissue. A canal, craniopharyngeal canal, is sometimes found extending from the anterior part of the fossa hypophyseos of the sphenoid bone to the under surface of the skull, and marks the original position of Rathke's pouch, while at the junction of the septum of the nose with the palate traces of the stomadeal end are occasionally present. Fraser. The pineal body. The pineal body, epiphysis, is a small reddish-gray body about 8 mm in length, which lies in the depression between the superior colliculi. It is attached to the roof of the third ventricle near its junction with the midbrain. It develops as an outgrowth from the third ventricle of the brain. In early life it has a glandular structure which reaches its greatest development at about the 7th year. Later, especially after puberty, the glandular tissue gradually disappears and is replaced by connective tissue. Structure. The pineal body is destitute of nervous substance, and consists of follicles lined by epithelium and enveloped by connective tissue. These follicles contain a variable quantity of gritty material composed of phosphate and carbonate of calcium, phosphate of magnesium and ammonia, and a little animal matter. It contains a substance which, if injected intravenously, causes fall of blood pressure. It seems probable that the gland furnishes an internal secretion in children that inhibits the development of the reproductive glands, since the invasion of the gland in children by pathological growths which practically destroy the glandular tissue results in accelerated development of the sexual organs, increased growth of the skeleton, and precocious mentality. End of section 44. Section 45 of Gray's Anatomy Part 5. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recorded by Laurie Anne Walden. Anatomy of the Human Body, Part 5, by Henry Gray. The chromophil and cortical systems. Chromophil or chromaffin cells, so called because they stain yellow or brownish with chromium salts, are associated with the ganglia of the sympathetic nervous system. Development. They arise in common with the sympathetic cells from the neural crest, and are therefore ectodermal in origin. The chromophil and sympathetic cells are indistinguishable from one another at the time of their migration from the spinal ganglia to the regions occupied in the adult. Differentiation of chromophil cells begins in embryos about 18 mm in length, but is not complete until about birth. The chromophiloblasts increase in size more than the sympathoblasts and stain less intensely with ordinary dyes. Later the chrome reaction develops. The aortic bodies differentiate first, and are prominent in 20 mm embryos. The paraganglia of the sympathetic plexuses differentiate next and last of all the paraganglia of the sympathetic trunk. The carotid body is completely differentiated in 30 mm embryos. After birth the chromophil organs degenerate, but the paraganglia can be recognized with the microscope in sites ordinarily occupied by them. The paraganglia are small groups of chromophil cells connected with the ganglia of the sympathetic trunk and the ganglia of the celiac, renal, suprarenal, aortic, and hypogastric plexuses. They are sometimes found in connection with the ganglia of other sympathetic plexuses. None have been found with the sympathetic ganglia associated with the branches of the trigeminal nerve. The aortic glands, or bodies, are the largest of these groups of chromophil cells, and measure, in the newborn, about 1 cm in length. They lie one on either side of the aorta in the region of the inferior mesenteric artery. They decrease in size with age and after puberty are only visible with the microscope. About 40 they disappear entirely. Other groups of chromophil cells have been found associated with the sympathetic plexuses of the abdomen independently of the ganglia. The medullary portions of the suprarenal glands and the glomus caroticum belong to the chromophil system. The suprarenal glands, glandulae suprarenalis, adrenal capsule. The suprarenal glands are two small flattened bodies of a yellowish color, situated at the back part of the abdomen, behind the peritoneum, and immediately above and in front of the upper end of each kidney, hence their name. The right one is somewhat triangular in shape, bearing a resemblance to a cocked hat. The left is more semilunar, usually larger, and placed at a higher level than the right. They vary in size in different individuals, being sometimes so small as to be scarcely detected. Their usual size is from 3 to 5 centimeters in length, rather less in width, and from 4 to 6 millimeters in thickness. Their average weight is from 1.5 to 2.5 grams each. Development. Each suprarenal gland consists of a cortical portion derived from the coelomic epithelium and a medullary portion originally composed of sympathochromaffin tissue. The cortical portion is first recognizable about the beginning of the 4th week as a series of buds from the coelomic cells at the root of the mesentery. Later it becomes completely separated from the coelomic epithelium and forms a suprarenal ridge projecting into the coelom between the mesonephros and the root of the mesentery. Into this cortical portion cells from the neighboring masses of sympathochromaffin tissue migrate along the line of its central vein to reach and form the medullary portion of the gland. Relations. The relations of the suprarenal glands differ on the two sides of the body. The right suprarenal is situated behind the inferior vena cava and right lobe of the liver and in front of the diaphragm and upper end of the right kidney. It is roughly triangular in shape. Its base, directed downward, is in contact with the medial and anterior aspects of the upper end of the right kidney. It presents two surfaces for examination, an anterior and a posterior. The anterior surface looks forward and lateralward, and has two areas, a medial, narrow, and non-peritoneal, which lies behind the inferior vena cava, and a lateral, somewhat triangular, in contact with the liver. The upper part of the latter surface is devoid of peritoneum, and is in relation with the bare area of the liver near its lower and medial angle, while its inferior portion is covered by peritoneum, reflected onto it from the inferior layer of the coronary ligament. Occasionally the duodenum overlaps the inferior portion. A little below the apex, and near the anterior border of the gland, is a short furrow termed the hilum, from which the suprarenal vein emerges to join the inferior vena cava. The posterior surface is divided into upper and lower parts by a curved ridge. The upper, slightly convex, rests upon the diaphragm. The lower, concave, is in contact with the upper end and the adjacent part of the anterior surface of the kidney. The left suprarenal, slightly larger than the right, is crescentic in shape, its concavity being adapted to the medial border of the upper part of the left kidney. It presents a medial border which is convex, and a lateral which is concave. Its upper end is narrow, and its lower rounded. Its anterior surface has two areas, an upper one, covered by the peritoneum of the omental bursa, which separates it from the cardiac end of the stomach, and sometimes from the superior extremity of the spleen, and a lower one, which is in contact with the pancreas and lienal artery, and is therefore not covered by the peritoneum. On the anterior surface, near its lower end, is a furrow or hilum, directed downward and forward, from which the suprarenal vein emerges. Its posterior surface presents a vertical ridge, which divides it into two areas. The lateral area rests on the kidney, the medial and smaller on the left crus of the diaphragm. The surface of the suprarenal gland is surrounded by areolar tissue containing much fat, and closely invested by a thin fibrous capsule, which is difficult to remove on account of the numerous fibrous processes and vessels entering the organ through the furrows on its anterior surface and base. Small accessory suprarenals, glandulae suprarenales accessoriae, are to be found in the connective tissue around the suprarenals. The smaller of these, on section, show a uniform surface, but in some of the larger a distinct medulla can be made out. Structure. On section, the suprarenal gland is seen to consist of two portions, an external or cortical, and an internal or medullary. The former constitutes the chief part of the organ, and is of a deep yellow color. The medullary substance is soft, pulpy, and of a dark red or brown color. The cortical portion, substantia corticalis, consists of a fine connective tissue network in which is embedded the glandular epithelium. The epithelial cells are polyhedral in shape and possess rounded nuclei. Many of the cells contain coarse granules, others lipoid globules. Owing to differences in the arrangement of the cells, three distinct zones can be made out. 1. The Zona Glomerulosa, situated beneath the capsule, consists of cells arranged in rounded groups, with here and there indications of an alveolar structure. The cells of this zone are very granular and stain deeply. 2. The Zona fasciculata, continuous with the Zona Glomerulosa, is composed of columns of cells arranged in a radial manner. These cells contain finer granules and, in many instances, globules of lipoid material. 3. The Zona reticularis, in contact with the medulla, consists of cylindrical masses of cells irregularly arranged. These cells often contain pigment granules which give this zone a darker appearance than the rest of the cortex. The medullary portion, substantia medullaris, is extremely vascular, and consists of large chromophil cells arranged in a network. The irregular polyhedral cells have a finely granular cytoplasm that are probably concerned with the secretion of adrenaline. In the meshes of the cellular network are large anastomosing venous sinuses, sinusoids, which are in close relationship with the chromophil or medullary cells. In many places the endothelial lining of the blood sinuses is in direct contact with the medullary cells. Some authors consider the endothelium absent in places, and here the medullary cells are directly bathed by the blood. This intimate relationship between the chromophil cells and the bloodstream undoubtedly facilitates the discharge of the internal secretion into the blood. There is a loose meshwork of supporting connective tissue containing non-striped muscle fibers. This portion of the gland is richly supplied with non-medullated nerve fibers, and here and there sympathetic ganglia are found. Vessels and nerves. The arteries supplying the suprarenal glands are numerous and of comparatively large size. They are derived from the aorta, the inferior phrenic, and the renal. They subdivide into minute branches previous to entering the cortical part of the gland, where they break up into capillaries, which end in the venous plexus of the medullary portion. The suprarenal vein returns the blood from the medullary venous plexus and receives several branches from the cortical substance. It emerges from the hilum of the gland, and on the right side opens into the inferior vena cava, on the left into the renal vein. The lymphatics end in the lumbar glands. The nerves are exceedingly numerous, and are derived from the celiac and renal plexuses, and according to Bergman from the phrenic and vagus nerves. They enter the lower and medial part of the capsule, traverse the cortex, and end around the cells of the medulla. They have numerous small ganglia developed upon them in the medullary portion of the gland. In connection with the development of the medulla from the sympathochromaffin tissue, it is to be noted that this portion of the gland secretes a substance, adrenaline, which has a powerful influence on those muscular tissues which are supplied by sympathetic fibers. Glomus caroticum, carotid glands, carotid bodies. The carotid bodies, 2 in number, are situated one on either side of the neck, behind the common carotid artery at its point of bifurcation into the external and internal carotid trunks. They are reddish-brown in color and oval in shape, the long diameter measuring about 5 millimeters. Each is invested by a fibrous capsule and consists largely of spherical or irregular masses of cells, the masses being more or less isolated from one another by septa which extend inward from the deep surface of the capsule. The cells are polyhedral in shape, and each contains a large nucleus embedded in finely granular protoplasm, which is stained yellow by chromic salts. Numerous nerve fibers, derived from the sympathetic plexus on the carotid artery, are distributed throughout the organ, and a network of large sinusoidal capillaries ramifies among the cells. Glomus coccygeum, coccygeal gland or body, Luschka's gland. The glomus coccygeum is placed in front of, or immediately below, the tip of the coccyx. It is about 2.5 millimeters in diameter, and is irregularly oval in shape. Several smaller nodules are found around or near the main mass. It consists of irregular masses of round or polyhedral cells, the cells of each mass being grouped around a dilated sinusoidal capillary vessel. Each cell contains a large round or oval nucleus, the protoplasm surrounding which is clear and is not stained by chromic salts. End of section 45.
Of Anatomy of the Human Body, Part 5. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Anatomy of the Human Body, Part 5, by Henry Gray. The Spleen. Lion. The spleen is situated principally in the left hypochondriac region, but its superior extremity extends into the epigastric region. It lies between the fundus of the stomach and the diaphragm. It is the largest of the ductless glands, and is of an oblong, flattened form, soft, of very friable consistence, highly vascular, and of a dark purplish color. Development. The spleen appears about the 5th week as a localized thickening of the mesoderm in the dorsal mesogastrium above the tail of the pancreas. With the change in position of the stomach, the spleen is carried to the left, and comes to lie behind the stomach and in contact with the left kidney. The part of the dorsal mesogastrium which intervened between the spleen and the greater curvature of the stomach forms the gastrosplenic ligament. Relations. The diaphragmatic surface, facies diaphragmatica, external or phrenic surface, is convex, smooth, and is directed upward, backward, and to the left, except at its upper end, where it is directed slightly medialward. It is in relation with the under surface of the diaphragm, which separates it from the 9th, 10th, and 11th ribs on the left side, and the intervening lower border of the left lung and pleura. The visceral surface is divided by a ridge into an anterior or gastric and a posterior or renal portion. The gastric surface, facies gastrica, which is directed forward, upward, and medialward, is broad and concave, and is in contact with the posterior wall of the stomach, and below this with the tail of the pancreas. It presents near its medial border a long fissure, termed the hilum. This is pierced by several irregular apertures, for the entrance and exit of vessels and nerves. The renal surface, facies renalis, is directed medialward and downward. It is somewhat flattened, is considerably narrower than the gastric surface, and is in relation with the upper part of the anterior surface of the left kidney and occasionally with the left suprarenal gland. The superior extremity, extremitus superior, is directed toward the vertebral column, where it lies on a level with the 11th thoracic vertebra. The lower extremity or colic surface, extremitus inferior, is flat, triangular in shape, and rests upon the left flexure of the colon and the phrenico-colic ligament, and is generally in contact with the tail of the pancreas. The anterior border, margo anterior, is free, sharp, and thin, and is often notched, especially below. It separates the diaphragmatic from the gastric surface. The posterior border, margo posterior, more rounded and blunter than the anterior, separates the renal from the diaphragmatic surface. It corresponds to the lower border of the 11th rib and lies between the diaphragm and the left kidney. The intermediate margin is the ridge which separates the renal and gastric surfaces. The inferior border, internal border, separates the diaphragmatic from the colic surface. The spleen is almost entirely surrounded by peritoneum, which is firmly adherent to its capsule. It is held in position by two folds of this membrane. One, the phrenico-lional ligament, is derived from the peritoneum, where the wall of the general peritoneal cavity comes into contact with the omental bursa between the left kidney and the spleen. The lional vessels pass between its two layers. The other fold, the gastro-lional ligament, is also formed of two layers, derived from the general cavity and the omental respectively, where they meet between the spleen and the stomach. The short gastric and left gastroepiploic branches of the lional artery run between its two layers. The lower end of the spleen is supported by the phrenico-colic ligament. The size and weight of the spleen are liable to very extreme variations at different periods of life, in different individuals, and in the same individual under different conditions. In the adult, it is usually about 12 centimeters in length, 7 centimeters in breadth, and 3 or 4 centimeters in thickness, and weighs about 200 grams. At birth, its weight, in proportion to the entire body, is almost equal to what is observed in the adult, being as 1 to 350, while in the adult it varies from 1 to 320 and 400. In old age, the organ not only diminishes in weight, but decreases considerably in proportion to the entire body, being as 1 to 700. The size of the spleen is increased during and after digestion, and varies according to the state of nutrition of the body, being large in highly fed and small in starved animals. In malarial fever it becomes much enlarged, weighing occasionally as much as 9 kilos. Frequently in the neighborhood of the spleen, and especially in the gastrolional ligament and greater omentum, small nodules of splenic tissue may be found, either isolated or connected to the spleen by thin bands of splenic tissue. They are known as accessory spleens, lion accessorius, supernumerary spleen. They vary in size from that of a pea to that of a plum. Structure. The spleen is invested by two coats, an external serous and an internal fibroelastic coat. The external or serous coat, tunica serosa, is derived from the peritoneum. It is thin, smooth, and in the human subject intimately adherent to the fibroelastic coat. It invests the entire organ, except at the hilum and along the lines of reflection of the phrenico-lional and gastrolional ligaments. The fibroelastic coat, tunica albuginea, invests the organ, and at the hilum is reflected inward upon the vessels in the form of sheaths. From these sheaths, as well as from the inner surface of the fibroelastic coat, numerous small fibrous bands, trabeculæ, are given off in all directions. These, uniting, constitute the framework of the spleen. The spleen therefore consists of a number of small spaces or areolae formed by the trabeculæ. In these areolae is contained the splenic pulp. The fibroelastic coat, the sheaths of the vessels, and the trabeculæ are composed of white and yellow elastic fibrous tissues, the latter predominating. It is owing to the presence of the elastic tissue that the spleen possesses a considerable amount of elasticity, which allows of the very great variations in size that it presents under certain circumstances. In addition to these constituents of this tunic, there is found in man a small amount of non-striped muscular fiber, and in some mammalia, for example dog, pig, and cat, a large amount, so that the trabeculæ appear to consist chiefly of muscular tissue. The splenic pulp, pulpa lionis, is a soft mass of dark reddish-brown color, resembling grumous blood. It consists of a fine reticulum of fibers, continuous with those of the trabeculæ, to which are applied flat, branching cells. The meshes of the reticulum are filled with blood, in which, however, the white corpuscles are found to be in larger proportion than they are in ordinary blood. Large rounded cells, termed splenic cells, are also seen. These are capable of amoeboid movement, and often contain pigment and red blood corpuscles in their interior. The cells of the reticulum each possess a round or oval nucleus, and like the splenic cells, they may contain pigment granules in their cytoplasm. They do not stain deeply with carmine, and in this respect differ from the cells of the Malpighian bodies. In the young spleen, giant cells may also be found, each containing numerous nuclei or one compound nucleus. Nucleated red blood corpuscles have also been found in the spleen of young animals. Blood vessels of the spleen. The lingual artery is remarkable for its large size in proportion to the size of the organ, and also for its tortuous course. It divides into 6 or more branches, which enter the hilum of the spleen and ramify throughout its substance, receiving sheaths from an involution of the external fibrous tissue. Similar sheaths also invest the nerves and veins. Each branch runs in the transverse axis of the organ, from within outward, diminishing in size during its transit, and giving off in its passage smaller branches, some of which pass to the anterior, others to the posterior part. These ultimately leave the trabecular sheaths and terminate in the proper substance of the spleen in small tufts or pencils of minute arterioles, which open into the interstices of the reticulum formed by the branch sustenticular cells. Each of the larger branches of the artery supplies chiefly that region of the organ in which the branch ramifies, having no anastomosis with the majority of the other branches. The arterioles, supported by the minute trabeculae, traverse the pulp in all directions in bundles, pencillae, of straight vessels. Their trabecular sheaths gradually undergo a transformation, become much thickened, and converted into adenoid tissue, the bundles of connective tissue becoming looser and their fibrils more delicate, and containing in their interstices an abundance of lymph corpuscles. W. Mueller. The altered coat of the arterioles, consisting of adenoid tissue, presents here and there thickenings of a spheroidal shape, the lymphatic nodules, Malpighian bodies of the spleen. These bodies vary in size from about 0.25 mm to 1 mm in diameter. They are merely local expansions or hypoplasia of the adenoid tissue, of which the external coat of the smaller arteries of the spleen is formed. They are most frequently found surrounding the arteriole, which thus seems to tunnel them, but occasionally they grow from one side of the vessel only, and present the appearance of a sessile bud growing from the arterial wall. In transverse sections, the artery, in the majority of cases, is found in an eccentric position. These bodies are visible to the naked eye on the surface of a fresh section of the organ, appearing as minute dots of a semi-opaque whitish color in the dark substance of the pulp. In minute structure they resemble the adenoid tissue of lymph glands, consisting of a delicate reticulum, in the meshes of which lie ordinary lymphoid cells. The reticulum is made up of extremely fine fibrils, and is comparatively open in the center of the corpuscle, becoming closer at its periphery. The cells which it encloses are possessed of amoeboid movement. When treated with carmine they become deeply stained, and can be easily distinguished from those of the pulp. The arterioles end by opening freely into the splenic pulp. Their walls become much attenuated, they lose their tubular character, and the endothelial cells become altered, presenting a branched appearance, and acquiring processes which are directly connected with the processes of the reticular cells of the pulp. In this manner the vessels end, and the blood flowing through them finds its way into the interstices of the reticulated tissue of the splenic pulp. Thus the blood passing through the spleen is brought into intimate relation with the elements of the pulp, and no doubt undergoes important changes. After these changes have taken place, the blood is collected from the interstices of the tissue by the rootlets of the veins, which begin much in the same way as the arteries end. The connective tissue corpuscles of the pulp arrange themselves in rows, in such a way as to form an elongated space or sinus. They become elongated and spindle-shaped, and overlap each other at their extremities, and thus form a sort of endothelial lining of the path or sinus, which is the radicle of a vein. On the outer surfaces of these cells are seen delicate transverse lines or markings, which are due to minute elastic fibrulae arranged in a circular manner around the sinus. Thus the channel obtains an external investment, and gradually becomes converted into a small vein, which after a short course acquires a coat of ordinary connective tissue, lined by a layer of flattened epithelial cells, which are continuous with the supporting cells of the pulp. The smaller veins unite to form larger ones. These do not accompany the arteries, but soon enter the trabecular sheaths of the capsule, and by their junction form 6 or more branches, which emerge from the hilum, and uniting constitute the lingual vein, the largest radicle of the portal vein. The veins are remarkable for their numerous anastomoses, while the arteries hardly anastomose at all. The lymphatics are described on page 711. The nerves are derived from the celiac plexus and are chiefly non-medullated. They are distributed to the blood vessels and to the smooth muscle of the capsule and trabeculae. End of section 46.
Of Gray's Anatomy, Part 5. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recording by John K. Thomas, also known as Vern or John Coos. Anatomy of the Human Body, Part 5 by Henry Gray. 12. Surface anatomy and surface markings. 1. Surface anatomy of the head and neck. Bones, figure 1193. Various bony surfaces and prominences on the skull can be easily identified by palpation. The external occipital protuberance is situated behind, in the middle line, at the junction of the skin of the neck with that of the head. The superior nuchal line runs lateralward from it on either side, while extending downward from it the median nuchal crest, situated deeply at the bottom of the nuchal furrow. Above the superior nuchal lines, the vault of the cranium is thinly covered with soft structures, so that the form of this part of the head is almost that of the upper portion of the occipital, the parietal, and the frontal bones. The superior nuchal line can be followed lateralward to the mastoid portion of the temporal bone, from which the mastoid process projects downward and forward behind the ear. The anterior and posterior borders, the apex, and the external surface of this process are all available for superficial examination. The anterior border lies immediately behind the concha, and the apex is on a level with the lobule of the auricula, about 1 centimeter below and in front of the apex of the mastoid process. The transverse process of the atlas can be distinguished. In front of the ear, the zygomatic arch can be felt throughout its entire length. Its posterior end is narrow and is situated a little above the level of the tragus. Its anterior end is broad and is continued into the zygomatic bone. The lower border of the arch is more distinct than the upper, which is obscured by the attachment of the temporal fascia. In front and behind, the upper border of the arch can be followed into the superior temporal line. In front, this line begins at the zygomatic process of the frontal bone as a curved ridge, which runs at first forward and upward on the frontal bone, and then curving backward separates the forehead into the temporal fossa. It can be traced across the parietal bone, where, though less marked, it can generally be recognized. Finally, it curves downward and forward, and passing above the external acoustic meatus, ends in the posterior root of the zygomatic arch. Near the line of the greatest transverse diameter of the head are the parietal eminences on either side of the middle line. Further forward, on the forehead, are the frontal eminences, which vary in prominence in different individuals and are frequently unsymmetrical. Below the frontal eminences, the superciliary arches, which indicate the position of the frontal sinuses, can be recognized. As a rule, they are small in the female and absent in children. In some cases, the prominence of the superciliary arches is related to the size of the frontal sinuses, but frequently there is no such relationship. Situated between and connecting the superciliary ridges is a smooth, somewhat triangular area, the glabella, below which the nasion, the frontal nasal suture, can be felt as a slight depression at the root of the nose. Below the nasion, The nasal bones, scantily covered by soft tissues, can be traced to their junction with the nasal cartilages, and on either side of the nasal bone the complete outline of the orbital margin can be made out. At the junction of the medial and intermediate thirds of the supraorbital margin, the supraorbital notch, when present, can be felt. Close to the medial end of the infraorbital margin is a little tubercle which serves as a guide to the position of the lacrimal sac. Below and lateral to the orbit, on either side, is the zygomatic bone forming the prominence of the cheek. Its posterior margin is easily palpable, and on it, just above the level of the lateral palpebral commissure, is the zygomatic tubercle. A slight depression about 1 centimeter above this tubercle indicates the position of the zygomatico-frontal suture. Directly below the orbit is a considerable part of the anterior surface of the maxilla, and the whole of its alveolar process can be palpated. The outline of the mandible can be recognized throughout practically its entire extent. In front of the tragus and below the zygomatic arch is the condyle, and from this posterior border of the ramus can be followed to the angle. From the angle to the symphysis, the lower rounded border of the mandible can be easily traced. The lower part of the anterior border of the ramus and the alveolar process can be made out without difficulty. In the receding angle below the chin is the hyoid bone, and the finger can be carried along the bone to the tip of the greater cornu, which is on level with the angle of the mandible. The greater cornu is most readily appreciated by making pressure on one side, when the cornu of the opposite side will be rendered prominent and can be felt distinctly beneath the skin. Joints and muscles. The temporomandibular articulation is quite superficial, and is situated below the posterior end of the zygomatic arch, in front of the external acoustic meatus. Its position can be ascertained by defining the condyle of the mandible. When the mouth opens, the condyle advances out of the mandibular fossa onto the articular tubercle, and a depression is felt in the situation of the joint. The outlines of the muscles of the head and face cannot be traced on the surface, except in the case of the masseter and temporalis. The muscles of the scalp are so thin that the outline of the bone is perceptible beneath them. Those of the face are small, covered by soft skin and often by a considerable layer of fat, and their outlines are therefore concealed. They serve, however, to round off and smooth prominent borders, and to fill up what would otherwise be unsightly angular depressions. Thus, the orbicularis oculi rounds off the prominent margin of the orbit, and the procerus fills in the sharp depression below the glabella. In like manner, the labial muscles converging to the lips, and assisted by the superimposed fat, fill up the sunken hollow of the lower part of the face. When in action, the facial muscles produce the various expressions, and in addition throw the skin into numerous folds and wrinkles. The masseter imparts fullness to hinder part of the cheek. If firmly contracted, as when the teeth are clenched, its quadrilateral outline is plainly visible. The anterior border forms a prominent vertical ridge, behind which is a considerable fullness, especially marked at the lower part of the muscle. The temporalis is fan-shaped and fills the temporal fossa, substituting for the concavity a somewhat convex swelling, the anterior part of which, on account of the absence of hair on the overlying skin, is more marked than the posterior, and stands out in strong relief when the muscle is in action. In the neck, the platysma, when contracted, throws the skin into oblique ridges parallel with the fasciiculi of the muscle. The sternocleidomastoidus has the most important influence on the surface form of the neck. When the muscle is at rest, its anterior border forms an oblique, rounded edge ending below on the sharp outline of the sternal head. The posterior border is only distinct for about 2 or 3 centimeters, above the middle of the clavicle. During contraction, the sternal head stands out as a sharply defined ridge, while the clavicular head is flatter and less prominent. Between the two heads is a slight depression. The fleshy middle portion of the muscle appears as an oblique elevation, with a thick, rounded anterior border best marked in its lower part. The sternal heads of the two muscles are separated by a V-shaped depression, in which are the sternohyoidus and sternothyroidus. Above the hyoid bone, near the middle line, the anterior belly of the didrasticus produces a slight convexity. The anterior border of the trapezius presents as a faint ridge running from the superior neutral line downward and forward to the junction of the intermediate and lateral thirds of the clavicle. Between the sternocleidomastoidus and the trapezius is the posterior triangle of the neck, the lower part of which appears as a shallow concavity, the supraclavicular fossa. In this fossa, the inferior belly of the omohyoideus, when in action, presents as a round cord-like elevation a little above and almost parallel to the clavicle. Figure 1195, front view of the neck. Arteries. The positions of several of the larger arteries can be ascertained from their pulsations. The subclavian artery can be felt by making pressure downward, backward, and medialward behind the clavicular head of the sternocleidomastoideus. Its transverse cervical branch may be detected parallel to and about a finger's breadth above the clavicle. The common and external carotid arteries can be recognized immediately beneath the anterior edge of the sternocleidomastoideus. The external maxillary artery can be traced over the border of the mandible just in front of the anterior border of the masseter, then about 1 centimeter, lateral to the angle of the mouth, and finally as it runs up the side of the nose. The pulsation of the occipital artery can be distinguished about 3 or 4 centimeters lateral to the external occipital protuberance, that of the posterior auricular, in the groove between the mastoid process and the auricula. The course of the superficial temporal artery can be readily followed across the posterior end of the zygomatic arch to a point about 3 to 5 centimeters above this, where it divides into its frontal and parietal branches. The pulsation of the frontal branch is frequently visible on the side of the forehead. The supraorbital artery can usually be detected immediately above the supraorbital notch or foramen. End of section 47. Recording by John K. Thomas, also known as Vern or John Coos. Web address www.validateyourlife.com or www.oneandthesamerecordings.com.
Grey's Anatomy Part 5. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recorded by Laurie Anne Walden. Anatomy of the Human Body, Part 5, by Henry Gray. Surface markings of special regions of the head and neck, Part 1. The cranium, scalp. The soft parts covering the upper surface of the skull form the scalp and comprise the following layers: 1. Skin. 2. Subcutaneous tissue. 3. Occipitalis frontalis and Gallia aponeurotica. 4. Subaponeurotic tissue. 5. Pericranium. The subcutaneous tissue consists of a close meshwork of fibers, the meshes of which contain fatty tissue. The fibers bind the skin and galea aponeurotica firmly together, so that when the occipitalis or the frontalis is in action, the skin moves with the aponeurosis. The subaponeurotic tissue, which intervenes between the galea aponeurotica and the pericranium, is much looser in texture, and permits the movement of the aponeurosis over the underlying bones. Bony landmarks. In addition to the bony points already described, which can be determined by palpation, the following are utilized for surface markings. Auricular point, the center of the orifice of the external acoustic meatus. Preauricular point, a point on the posterior root of the zygomatic arch immediately in front of the external acoustic meatus. Asterion, the point of meeting of the lambdoidal, masto-occipital, and masto-parietal sutures. It lies 4 cm behind and 12 mm above the level of the auricular point. Pterion, the point where the great wing of the sphenoid joins the sphenoidal angle of the parietal. It is situated 35 mm behind and 12 mm above the level of the frontozygomatic suture. Inion, the external occipital protuberance. Lambda, the point of meeting of the lambdoidal and sagittal sutures. It is in the middle line, about 6.5 cm above the inion. Bregma, the meeting point of the coronal and sagittal sutures. It lies at the point of intersection of the middle line of the scalp with a line drawn vertically upward through the preauricular point. A line passing through the inferior margin of the orbit and the auricular point is known as Reed's base line. The lambdoidal suture can be indicated on either side by the upper 2/3 of a line from the lambda to the tip of the mastoid process. The sagittal suture is in the line joining the lambda to the bregma. The position of the coronal suture on either side is sufficiently represented by a line joining the bregma to the center of the zygomatic arch. The floor of the middle fossa of the skull is at the level of the posterior 3/4 of the upper border of the zygomatic arch. The articular eminence of the temporal bone is opposite the foramen spinosum and the semilunar ganglion. Brain. The general outline of the cerebral hemisphere on either side may be mapped out on the surface in the following manner. Starting from the nasion, a line drawn along the middle of the scalp to the inion represents the superior border. The line of the lower margin behind is that of the transverse sinus, or more roughly a line convex upward from the inion to the posterior root of the zygomatic process of the temporal bone, thence along the posterior 2/3 of the upper border of the zygomatic arch, where the line turns up to the pterion. The front part of the lower margin extends from the pterion to the glabella about 1 cm above the supraorbital margin. The cerebellum is so deeply situated that there is no reliable surface marking for it. A point 4 cm behind and 1.5 cm below the level of the auricular point is situated directly over it. The relations of the principal fissures and gyri of the cerebral hemispheres to the surface of the scalp are of considerable practical importance, and several methods of indicating them have been devised. Necessarily, these methods can only be regarded as approximately correct, yet they are all sufficiently accurate for surgical purposes. The longitudinal fissure corresponds to the medial line of the scalp between the nasion and inion. In order to mark out the lateral cerebral sylvian fissure, a point, termed the sylvian point, which practically corresponds to the pterion, is defined 35 mm behind and 12 mm above the level of the frontozygomatic suture. This point marks the spot where the lateral fissure divides. Another method of defining the sylvian point is to divide the distance between the nasion and inion into 4 equal parts. From the junction of the third and fourth parts, reckoning from the front, draw a line to the frontozygomatic suture. From the junction of the first and second parts, a line to the auricular point. These two lines intersect at the sylvian point, and the portion of the first line behind this point overlies the posterior ramus of the lateral cerebral fissure. The position of the posterior ramus can otherwise be obtained by joining the sylvian point to a point 2 cm below the summit of the parietal eminence. The anterior ascending ramus can be marked out by drawing a line upward at right angles to the line of the posterior ramus for 2 cm, and the anterior horizontal ramus by a line of the same length drawn horizontally forward, both from the Sylvian point. To define the central sulcus, fissure of Rolando, 2 points are taken. One is situated 1.25 cm behind the center of the line joining the nasion and inion. The second is at the intersection of the line of the posterior ramus of the lateral cerebral fissure with a line through the preauricular point, at right angles to Reed's baseline. The upper 9 cm of the line joining these 2 points overlies the central sulcus and forms an angle, opening forward, of about 70 degrees with the middle line of the scalp. An alternative method is to draw 2 perpendicular lines from Reed's baseline to the top of the head, one from the preauricular point, and the other from the posterior border of the mastoid process at its root. A line from the upper end of the posterior line to the point where the anterior intersects the line of the posterior ramus of the lateral fissure indicates the position of the central sulcus. The precentral and postcentral sulci are practically parallel to the central sulcus. They are situated respectively about 15 mm in front of and behind it. The superior frontal sulcus can be mapped out by a line drawn from the junction of the upper and middle thirds of the precentral sulcus in a direction parallel with the longitudinal sulcus to a point midway between the middle line of the forehead and the temporal line, 4 cm above the supraorbital notch. The inferior frontal sulcus begins at the junction of the middle and lower thirds of the precentral sulcus and follows the course of the superior temporal line. The horizontal limb of the intraparietal sulcus begins from the junction of the lower with the middle third of the postcentral sulcus and curves backward parallel to the longitudinal fissure, midway between it and the parietal eminence. It then curves downward to end midway between the lambda and the parietal eminence. The external part of the parieto-occipital fissure runs lateralward at right angles to the longitudinal fissure for about 2.5 cm from a point 5 mm in front of the lambda. If the line of the posterior ramus of the lateral cerebral fissure be continued back to the longitudinal fissure, the last 2.5 cm of it will indicate the position of the parieto-occipital fissure. The lateral ventricle may be circumscribed by a quadrilateral figure. The upper limit is a horizontal line 5 cm above the zygomatic arch. This defines the roof of the ventricle. The lower limit is a horizontal line 1 cm above the zygomatic arch. It indicates the level of the end of the inferior horn. 2 vertical lines, one through the junction of the anterior and middle thirds of the zygomatic arch, and the other 5 cm behind the tip of the mastoid process, indicate the extent of the anterior horn in front and the posterior horn behind. Vessels. The line of the anterior division of the middle meningeal artery is equidistant from the frontozygomatic suture and the zygomatic arch. It is obtained by joining up the following points: 1. 2.5 cm, 2. 4 cm, and 3. 5 cm from these 2 landmarks. The posterior division can be reached 2.5 cm above the auricular point. The position of the transverse sinus is obtained by taking 2 lines, the first from the inion to a point 2.5 cm behind the auricular point, the second from the anterior end of the first to the tip of the mastoid process. The second line corresponds roughly to the line of reflection of the skin of the auricula behind, and its upper 2/3 represents the sigmoid part of the sinus. The first part of the sinus has a slight upward convexity, and its highest point is about 4 cm behind and 1 cm above the level of the auricular point. The width of the sinus is about 1 cm. The face. Air sinuses. The frontal and maxillary sinuses vary so greatly in form and size that their surface markings must be regarded as only roughly approximate. To mark out the position of the frontal sinus, 3 points are taken: 1. The nasion; 2. A point in the middle line 3 cm above the nasion; 3. A point at the junction of the lateral and intermediate thirds of the supraorbital margin. By joining these a triangular field is described which overlies the greater part of the sinus. The outline of the maxillary sinus is irregularly quadrilateral and is obtained by joining up the following points: 1. The lacrimal tubercle. 2. A point on the zygomatic bone at the level of the inferior and lateral margins of the orbit. 3 and 4. Points on the alveolar process above the last molar and the second premolar teeth, respectively. External maxillary artery. The course of this artery on the face may be indicated by a line starting from the lower border of the mandible at the anterior margin of the masseter, and running at first forward and upward to a point 1 cm lateral to the angle of the mouth, thence to the ala of the nose, and upward to the medial commissure of the eye. Trigeminal nerve. Terminal branches of this nerve, namely, the supraorbital branch of the ophthalmic, the infraorbital of the maxillary, and the mental of the mandibular, emerge from corresponding foramina on the face. The supraorbital foramen is situated at the junction of the medial and intermediate thirds of the supraorbital margin. A line drawn from this foramen to the lower border of the mandible, through the interval between the two lower premolar teeth, passes over the infraorbital and mental foramina. The former lies about 1 cm below the margin of the orbit, while the latter varies in position according to the age of the individual. In the adult it is midway between the upper and lower borders of the mandible; in the child it is nearer the lower border, while in the edentulous jaw of old age it is close to the upper margin. The position of the sphenopalatine ganglion is indicated from the side by a point on the upper border of the zygomatic arch, 6 mm from the margin of the zygomatic bone. Parotid Gland. The upper border of the parotid gland corresponds to the posterior 2/3 of the lower border of the zygomatic arch, the posterior border to the front of the external acoustic meatus, the mastoid process, and the anterior border of sternocleidomastoideus. The inferior border is indicated by a line from the tip of the mastoid process to the junction of the body and greater cornu of the hyoid bone. In front, the anterior border extends for a variable distance on the superficial surface of the masseter. The surface marking for the parotid duct is a line drawn across the face about a finger's breadth below the zygomatic arch, that is, from the lower margin of the concha to midway between the red margin of the lip and the ala of the nose. The duct ends opposite the second upper molar tooth and measures about 5 cm in length. The nose. The outlines of the nasal bones and the cartilages forming the external nose can be easily felt. The mobile portion of the nasal septum, formed by the medial crura of the greater alar cartilages and the skin, is easily distinguished between the nares. When the head is tilted back and a speculum introduced through the nares, the floor of the nasal cavity, the lower part of the nasal septum, and the anterior ends of the middle and inferior nasal conchae can be examined. The opening of the nasolacrimal duct, which lies under cover of the front of the inferior nasal concha, is situated about 2.5 cm behind the nares and 2 cm above the level of the floor of the nasal cavity. End of section 48. Of Gray's Anatomy, Part 5. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Recorded by Laurie Anne Walden. Anatomy of the Human Body, Part 5, by Henry Gray. Surface Markings and Special Regions of the Head and Neck, Part 2. The mouth. The orifice of the mouth is bounded by the lips, which are covered externally by the whitish skin and internally by the red mucous membrane. The size of the orifice varies considerably in different individuals, but seems to bear a close relationship to the size and prominence of the teeth. Its angles usually correspond to the lateral borders of the canine teeth. Running down the center of the outer surface of the upper lip is a shallow groove, the philtrum. If the lips be everted, there can be seen, in the middle line of each, a small fold of mucous membrane, the frenulum, passing from the lip to the gum. By pulling the angle of the mouth outward, the mucous membrane of the cheek can be inspected, and on this, opposite the second molar tooth of the maxilla, is the little papilla which marks the orifice of the parotid duct. In the floor of the mouth is the tongue. Its upper surface is convex and is marked along the middle line by a shallow sulcus. The anterior 2/3 are rough and studded with papillae. The posterior third is smooth and tuberculated. The division between the anterior 2/3 and the posterior third is marked by a V-shaped furrow, the sulcus terminalis, which is situated immediately behind the line of the valate papillae. On the undersurface of the tongue, the mucous membrane is smooth and devoid of papillae. In the middle line, the mucous membrane extends to the floor of the mouth as a distinct fold, the frenulum, the free edge of which runs forward to the symphysis menti. Sometimes the ranine vein can be seen immediately beneath the mucous membrane, a little lateral to the frenulum. Close to the attachment of the frenulum to the floor of the mouth, the slit-like orifice of the submaxillary duct is visible on either side. Running backward and lateralward from the orifice of the submaxillary duct is the plica sublingualis, produced by the projection of the sublingual gland which lies immediately beneath the mucous membrane. The plica serves also to indicate the line of the submaxillary duct and of the lingual nerve. At the back of the mouth is the isthmus falcium, bounded above by the palatine velum, from the free margin of which the uvula projects downward in the middle line. On either side of the isthmus are the two palatine arches, the anterior formed by the glossopalatinus and the posterior by the pharyngopalatinus. Between the two arches of either side is the palatine tonsil, above which is the small supratonsillar recess. The position of the tonsil corresponds to the angle of the mandible. When the mouth is opened widely, a tense band, the pterygomandibular raphe, can be seen and felt lateral to the glossopalatine arch. Its lower end is attached to the mandible behind the last molar tooth, and immediately below and in front of this the lingual nerve can be felt. The upper end of the ligament can be traced to the pterygoid hamulus. About 1 cm. In front of the hamulus and 1 cm. Medial to the last molar tooth of the maxilla is the greater palatine foramen through which the descending palatine vessels and the anterior palatine nerve emerge. Behind the last molar tooth of the maxilla, the carotid process of the mandible is palpable. By tilting the head well back, a portion of the posterior pharyngeal wall, corresponding to the site of the second and third cervical vertebrae, can be seen through the isthmus falcium. On introducing the finger, the anterior surfaces of the upper cervical vertebrae can be felt through the thin muscular wall of the pharynx. If the finger be hooked round the palatine velum, the choana can be distinguished in front, and the pharyngeal ostium of the auditory tube on either side. The level of the choana is that of the atlas, while the palatine velum is opposite the body of the axis. With a laryngoscope many other structures can be seen. In the nasal part of the pharynx, the choana, the nasal septum, the nasal conchae, and the pharyngeal ostia of the auditory tubes can all be examined. Further down, the base of the tongue, the anterior surface of the epiglottis, with the glossoepiglottic and pharyngoepiglottic folds bounding the valleculae and the piriform sinuses, are readily distinguished. Beyond these is the entrance to the larynx, bounded on either side by the aryepiglottic folds, in each of which are two rounded eminences corresponding to the corniculate and cuneiform cartilages. Within the larynx on either side are the ventricular and vocal folds, false and true vocal cords, with the ventricle between them. Still deeper are seen the cricoid cartilage and the anterior parts of some of the cartilaginous rings of the trachea, and sometimes, during deep inspiration, the bifurcation of the trachea. The eye. The palpebral fissure is elliptical in shape, and varies in form in different individuals and in different races of mankind. Normally it is oblique, in a direction upward and lateralward, so that the lateral commissure is on a slightly higher level than the medial. When the eyes are directed forward, as in ordinary vision, the upper part of the cornea is covered by the upper eyelid, and its lower margin corresponds to the level of the free margin of the lower eyelid, so that usually the lower 3/4 are exposed. At the medial commissure are the caruncula lachrymalis and the plica semilunaris. When the lids are everted, the tarsal glands appear as a series of nearly straight parallel rows of light yellow granules. On the margins of the lids, about 5 mm from the medial commissure, are two small openings, the lacrimal puncta. In the natural condition they are in contact with the conjunctiva of the bulb of the eye, so that it is necessary to avert the eyelids to expose them. The position of the lacrimal sac is indicated by a little tubercle which can be plainly felt on the lower margin of the orbit. The sac lies immediately above and medial to the tubercle. If the eyelids be drawn lateralward so as to tighten the skin at the medial commissure, a prominent core can be felt beneath the tightened skin. This is the medial palpebral ligament, which lies over the junction of the upper with the lower 2/3 of the sac, thus forming a useful guide to its situation. The direction of the nasolacrimal duct is indicated by a line from the lacrimal sac to the first molar tooth of the maxilla. The length of the duct is about 12 or 13 millimeters. On looking into the eye, the iris with its opening, the pupil, and the front of the lens can be examined. But for investigation of the retina an ophthalmoscope is necessary. With this the lens, the vessels of the retina, the optic disc, and the macula lutea can all be inspected. On the lateral surface of the nasal part of the frontal bone the pulley of the obliquus superior can be easily reached by pushing the finger backward along the roof of the orbit. The tendon of the muscle can be traced for a short distance backward and lateralward from the pulley. The ear. The various prominences and fossae of the auricula are visible. The opening of the external acoustic meatus is exposed by drawing the tragus forward. At the orifice are a few short, crisp hairs which serve to prevent the entrance of dust or of small insects. Beyond this the secretion of the ceruminous glands serves to catch any small particles which may find their way into the meatus. The interior of the meatus can be examined through a speculum. At the line of junction of its bony and cartilaginous portions an obtuse angle is formed, which projects into the antero-inferior wall, and produces a narrowing of the lumen in this situation. The cartilaginous part, however, is connected to the bony part by fibrous tissue, which renders the outer part of the meatus very movable, and therefore by drawing the auricula upward, backward, and slightly outward, the canal is rendered almost straight. In children the meatus is very short, and this should be remembered in introducing the speculum. Through the speculum the greater part of the tympanic membrane is visible. It is a pearly gray membrane, slightly glistening in the adult, placed obliquely so as to form with the floor of the meatus an angle of about 55 degrees. At birth it is more horizontal and situated in almost the same plane as the base of the skull. The membrane is concave outward, and the point of deepest concavity, the umbo, is slightly below the center. Running upward and slightly forward from the umbo is a reddish-yellow streak produced by the manubrium of the malleus. This streak ends above, just below the roof of the meatus, at a small white rounded prominence which is caused by the lateral process of the malleus projecting against the membrane. The anterior and posterior malleolar folds extend from the prominence to the circumference of the membrane and enclose the pars flaccida. Behind the streak caused by the manubrium of the malleus, a second streak, shorter and very faint, can be distinguished. This is the long crus of the incus. A narrow triangular patch extending downward and forward from the umbo reflects the light more brightly than any other part, and is usually described as the cone of light. Tympanic antrum. The site of the tympanic antrum is indicated by the suprameatal triangle. This triangle is bounded above by the posterior root of the zygomatic arch, behind by a vertical line from the posterior border of the external acoustic meatus, in front and below by the upper margin of the meatus. The neck, larynx and trachea. In the receding angle below the chin, the hyoid bone, situated opposite the fourth cervical vertebra, can easily be made out. A finger's breadth below it is the laryngeal prominence of the thyroid cartilage. The space intervening between the hyoid bone and the thyroid cartilage is occupied by the hyothyroid membrane. The outlines of the thyroid cartilage are readily palpated. Below its lower border is a depression corresponding to the middle cricothyroid ligament. The level of the vocal folds corresponds to the middle of the anterior margin of the thyroid cartilage. The anterior part of the cricoid cartilage forms an important landmark on the front of the neck. It lies opposite the sixth cervical vertebra, and indicates the junctions of pharynx with esophagus, and larynx with trachea. Below the cricoid cartilage the trachea can be felt, though it is only in thin subjects that the separate rings can be distinguished. As a rule there are 7 or 8 rings above the jugular notch of the sternum, and of these the second, third, and fourth are covered by the isthmus of the thyroid gland. Muscles. The posterior belly of Digastricus is marked out by a line from the tip of the mastoid process to the junction of the greater cornu and body of the hyoid bone. A line from this latter point to a point just lateral to the symphysis menti indicates the position of the anterior belly. The line of omohyoideus begins at the lower border of the hyoid bone, curves downward and lateralward to cross sternocleidomastoideus at the junction of its middle and lower thirds, that is, opposite the cricoid cartilage, and then runs more horizontally to the acromial end of the clavicle. Arteries. The position of the common carotid artery in the neck is indicated by a line drawn from the upper part of the sternal end of the clavicle to a point midway between the tip of the mastoid process and the angle of the mandible. From the clavicle to the upper border of the thyroid cartilage, this line overlies the common carotid artery. Beyond this it is over the external carotid. The external carotid artery may otherwise be marked out by the upper part of a line from the side of the cricoid cartilage to the front of the external acoustic meatus, arching the line slightly forward. The points of origin of the main branches of the external carotid in the neck are all related to the tip of the greater cornu of the hyoid bone as follows: 1. The superior thyroid, immediately below it. 2. The lingual, on a level with it. 3. The facial, and 4. The occipital, a little above and behind it. The subclavian artery is indicated on the surface by a curved line, convex upward, from the sternoclavicular articulation to the middle of the clavicle. The highest point of the convexity is from 1 to 3 cm above the clavicle. Veins. The surface marking for the internal jugular vein is slightly lateral and parallel to that for the common carotid artery. The position of the external jugular vein is marked out by a line from the angle of the mandible to the middle of the clavicle. A point on this line about 4 cm above the clavicle indicates the spot where the vein pierces the deep fascia. The line of the anterior jugular vein begins close to the symphysis menti, runs downward parallel with and a little to one side of the middle line, and, at a variable distance above the jugular notch, turns lateralward to the external jugular. Nerves. The facial nerve, at its exit from the stylomastoid foramen, is situated about 2.5 cm from the surface, opposite the middle of the anterior border of the mastoid process. A horizontal line from this point to the ramus of the mandible overlies the stem of the nerve. To mark the site of the accessory nerve, a line is drawn from the angle of the mandible to a point on the anterior border of sternocleidomastoideus, about 3 to 4 cm below the apex of the mastoid process, or to the midpoint of the posterior border of the muscle. The line is continued across the posterior triangle to trapezius. The cutaneous branches of the cervical plexus as they emerge from the posterior border of sternocleidomastoideus may be indicated as follows. The lesser occipital begins immediately above the midpoint of the border and runs along the border to the scalp. The great auricular and cervical cutaneous both start from the middle of the border, the former running upward toward the lobule of the auricula, the latter crossing sternocleidomastoideus at right angles to its long axis. The supraclavicular nerves emerge from immediately below the middle of the posterior border and run down over the clavicle. The phrenic nerve begins at the level of the middle of the thyroid cartilage and runs behind the clavicle about midway between the anterior and posterior borders of sternocleidomastoideus. The upper border of the brachial plexus is indicated by a line from the side of the cricoid cartilage to the middle of the clavicle. Submaxillary gland. On either side of the neck, the superficial portion of the submaxillary gland, as it lies partly under cover of the mandible, can be palpated. End of section 49.